that this bill has finally made it to the floor of the Dáil. It has been long overdue, and it's been a long road to get here. And obviously there are rightfully concerns from all of us as to whether this legislation can be progressed in however long there is left in the lifetime of this government. But I believe that to make it the first key piece of legislation to be discussed after the recess, I think is a good step, and hopefully we can all get to work through the second stage into committee and put our amendments through and see this bill in an amended form, we hope, but become law in the not too distant future. There is a lot of good in this bill. The introduction of a nominated person to be someone's advocate is welcome. Those who are going through mental health issues often find it difficult to advocate for themselves, especially in those moments when they really need to. So this will be a very real and impactful change for many people. The changes around involuntary admission are also really important, and will hopefully be a start in addressing our need to separate mental health difficulties from criminal justice issues. There is still such a stigma around mental health, and the links people have been making between mental health difficulties and criminal activity has only further inflamed that stigma, which has very real-world implications on so many people. I also think it's important to welcome this bill puts time limits on how long you should have to wait before an authorised officer sees you to make an application recommending someone for involuntary admission. People in distress cannot and should not be left indefinitely for someone to treat them. But I do have concerns in how we will ensure this does not happen even when the legislation is in place in regard to the resources and staffing, which I will touch upon later. However, it is important that we see the intent included in this legislation. The regulation of mental health services that is introduced in this bill is also important moving forward. It is something I and colleagues across the Chamber have been calling for, and its implementation will be vital. Of course, we have a huge issue due to the lack of regulation and the over and under medicating of the Maskey report, stating as much, with significant harm being caused to 46 children because of over-prescribing by a junior doctor. Over-medication is extremely dangerous and can have lifelong damage. One case of this was so extreme that a young man who was over-medicated by the North Kerry CAMS service had to undergo surgery because of the impact on his body. So to see regulations finally introduced is welcome, and we need to make sure that they are thorough and efficient. There are things we feel need to be added to this bill as it moves forwards, and I want to take the opportunity to highlight the work of mental health reform, who have been so dogged, diligent and committed in advocating for a robust mental health bill for the entire lifetime of this Dáil, for which I've been a member and indeed before. I want to support their views on a number of aspects in the bill as it is written and presented before us, starting with the concerns regarding the provision for An Garda Síochána to take people into custody without proper safeguards. Currently, during a mental health crisis, individuals are directed to present to their nearest A&E, go to their GP or utilise services such as crisis resolution service. However, the issue arises over the lack of being able to distinguish between the risk to self and the risk to others. This speaks further to a point about the stigma around mental health difficulties and the conflation that can happen in regard to acts. We need to see risk to self and risk to others clearly separated, and additional safeguards must be put in place to address concerns. We want to see people being brought to relevant healthcare facilities where medical professionals can de-escalate a situation and begin a process for admission, if indeed that's what's required. This is what professionals are trained for, and custody, judicial custody, is not an environment that is conducive to de-escalation or indeed improved mental health. As mental health reform point out, Gardaí themselves have previously raised concerns over this, quoting, "Stations are not places for mental health patients." In regard to advocates, which I welcomed, I do agree with mental health reform's position that there is still a need to reference the right to an independent advocate. This is such an important part of legislation, and it does not make sense to us to unintentionally have people disenfranchised, as it is those most marginalised who may not have close family members or outside supporters and who would be in need of an independent advocate. The obligation on the state to provide a statutory right to an independent advocate is required. Something we absolutely need to see in the amendments to this bill is an explicit prohibition on admitting children into adult psychiatric units. This is an absolute necessity, and budgetary reasons cannot be put forward as the reason why children continue to be admitted to adult psychiatric units. I acknowledge that simply having something in law does not mean that the practice will no longer happen, as we have seen with the assessment of needs statutory limits, for example. However, if nothing else, we need to see this as a starting point to ensure further improvements happen ASAP and further resources are put in to ensure that our children aren't admitted to adult psychiatric wards. The Labour Party also supports the call for inclusion of an independent complaints mechanism. It is common sense that sometimes people are nervous about making complaints directly to the place where they've also been receiving treatment, and as has unfortunately been seen, sometimes there is just need for a complaint. Removing barriers so people feel safe to do so is very, very important. Finally, I would like to see the government examine the review timeframe of 10 years, which is far higher than the usual 5-year review. I don't think we should be seen to be going backwards in this regard from the 2001 Act, which was supposed to have been reviewed 5 years after commencement. As I already touched upon, this bill is welcome, but it needs to be a good starting point and is not the finished article or the finished bill as far as we're concerned, and certainly in its current form won't be robust enough to see us through the next decade and beyond. More widely, a point I really want to make clear today is our responsibility as elected representatives to lead the way on removing the stigma that still exists around mental health, especially for our young people. There's been a huge increase over the last number of years in social media influencers who usually target young men who frame those who deal with mental health difficulties as something to be ashamed of, something that could be fixed if they just either go to the gym or make their bed. We need to push back on this narrative. Mental health difficulties do not only look like what they are portrayed like on TV, and we need to lead with empathy, not judgment. And as important as we need to be consistent so that we ensure that nobody gets left behind with the services that this country provides. Sadly, even with this legislation, people are being left behind, and it's those people, particularly those people with autism, who have been and continue to be forgotten. This is an issue I raised earlier this year in regard to CAM services. The fact, and it is fact, that the system is failing autistic children. CAM's operational guidelines set out that admission to services can be refused to autistic children where there is an absence of a moderate to severe mental disorder. Where there is such a disorder, it is the role of CAM to provide, quote, appropriate multidisciplinary mental health assessment and treatment. Frequently, however, and we all will have experienced this, we are just not seeing care provided even when there is this disorder. I know many families facing this barrier feel that children with autism are being left behind by a system that feels it is easier to deny them any treatment than to pass on the responsibility to someone else and intervene with a multidisciplinary approach. One of the biggest indicators that the state is failing in its responsibility to provide adequate medical care for its citizens is when they have to fly abroad to get it, and this continues to happen in Ireland. Members of a group called Families for Reform, who I'm sure most of us are familiar with, have outright stated that they have travelled to Spain so their child can get care. What does it say about us that we are letting this happen? I know my advice clinic have parents with autistic children who are simply at their wits' end and trying to get their child the help that other children in this country are entitled to, and the help that they are not getting. I will finish by saying that there is a lot of good in this bill, as I've said, but there is a lot missing, and we hope that you will be open to progressive and constructive amendments. And just before I take my seat, I would also like to say the broader point that we have heard that this recruitment embargo has been lifted across the health service, but the reality is the opposite. We, across a wide range of services, from mental health services, across acute care, primary care, social work, we are seeing vacancies being unfilled. We are seeing the recruitment embargo continue to exist in reality, even though apparently it has been lifted. It is an absolute scandal when the government are tripping over themselves to try and decide how to spend the many billions they continue to find either down the back of the couch through unexpected tax intakes or indeed through the Apple money, that we are not really lifting the recruitment embargo and hiring the frontline health service staff, the supporting staff that help our frontline health service staff do the jobs that they're needed in Ireland today. And I think that's something that this government needs to be honest about, that every minister or junior minister across the health brief needs to be honest about, that this recruitment embargo is still in place in practice and needs to be lifted, and we need to start hiring people across our health service again. Thank you.